Good evening, good evening, good evening, and welcome to the Central Jamaica Conference online platform and to your health and you. Remember to like, share, and subscribe. Your Health and You is a production of the Central Jamaica Conference Health Ministries Department, designed to present on health-related topics by sharing evidence-based information and naturopathic remedies. Your Health and You is aired every Thursday at 7:15 p.m. with focus on general health on first Thursdays, men's health on second Thursdays, women's health on third Thursdays, children's health on fourth Thursdays, and mental health on fifth Thursdays. This program is for educational and informational purposes only and does not constitute providing medical advice or professional services. So, before embarking on any health related information presented in this series, kindly seek advice or counsel from a doctor or a healthcare professional. Now, in today's program, we will be speaking about chronic myofascial pain. Yes, you heard me right. Chronic myofascial pain. Before we dive into our topic, though, let's enjoy a reading from the book Counsels on Health by Ellen G. White, which will be followed by prayer.
The Outlook.
They will be encouraged as they see doors opening for them to enter places where they can do medical missionary work. Having little self-confidence, they give God all the glory. Their hands may be rough and unskilled, but their hearts are susceptible to pity. They are filled with an earnest desire to do something to relieve the woe so abundant, and Christ is present to help them. He works through those who discern mercy in misery, gain in the loss of all things when the light of the world passes by. Privileges appear in all hardships, order in confusion, the success and wisdom of God in that which has seemed to be a failure. My brethren and sisters, in your ministry, come close to the people. Uplift those who are cast down. Treat of calamities as disguised blessings. Work in a way that will cause hope to spring up in the place of despair. God, the source of wisdom and power. To every worker I would say, go forth in humble faith, and the Lord will go with you. But watch unto prayer. This is the science of your labor. The power is of God. Work in dependence upon Him, remembering that you are laborers together with Him. He is your helper. Your strength is from Him. He will be your wisdom, your righteousness, your sanctification, your redemption.
Let us pray. Most righteous and eternal Father, Lord, we just give you thanks. We just thank you for the God that you are. We thank you, Lord, that we can come together on this platform to magnify your name and to learn of all the wonderful things that you have put in place for the health of your people. We ask, Lord, that tonight as we listen, tonight as we learn, that we will not only just hear the information, but we will be doers as well. And while we do, we'll tell others who have not been so blessed to hear this information this evening. So, Lord, we just ask that you come into our presence. We ask that you'll hasten the footsteps of those who will join us, and that you'll bless our hearts tremendously as we continue to give you all the glory, all the honor, and all the praise. In Jesus' name, amen. Now, in our Did You Know segment, Did you know up to 85% of the population is affected by myofascial pain, but many don't even know that this condition is a sickness. Many persons live with pain and are considered to have chronic myofascial syndrome, but live with the pain thinking it is normal or that treatment isn't really available, expecting except living on pain medication. Did you also know that myofascial pain syndrome is usually found in the population age of 27 to 50 years old? Did you know this? All right. While you ponder that, I'll ask for us to go now to our celebration video.
Celebrations, optimism. There are a lot of synonyms you could use to describe optimism: happiness, hope, joyfulness, positive attitude, high spirits. However, optimism might be best described as an enduring tendency to expect good personal outcomes. Seeing life from an optimistic perspective is something everyone should try. When you face challenges with a heart and mind full of hope, you'll be able to see the good side of things. With optimism, you can find peace and joy even when situations don't turn out the way you had wanted. You can start practicing optimism by smiling whenever you can. Laughter is indeed good medicine. It increases your endorphin levels. It makes you feel better, mentally and physically. Positive thoughts can help too. Nurturing good thoughts about people and situations improves your personal well-being and positively impacts your relationships with others. You'll feel the positive effects of optimism in all aspects of life. Optimism not only improves your health, but also helps you cope with adversity. Optimism is truly the joy of life.
There you go. So you are encouraged to smile and smile when you can because this is healthy. It is good for you. And I optimistically tell you now about our special guest. Our special guest is Dr. Everton McIntosh, consultant anesthetist, intensive care and pain management specialist. He is also the senior medical officer at the Mandeville Regional Hospital. He is a member of the NCU Church and actively serves as prison ministry director and assistant health ministry director. So, you know, we have a lot in store for you from this gentleman. So stay with us. Remember to post your questions and your comments in the chat. We will go again to a short break, and after that, we'll be joined by Dr. McIntosh. Soon call.
Neglecting shared family meals can keep you from achieving better health and weight control, positive social outcomes, better grades, and can also increase the chance of involvement with drugs, cigarettes, and alcohol. And these negative outcomes aren't just for kids. At the same time, numerous studies reveal that all ages, races, ethnic groups, levels of education, employment, and income benefit by eating with family. That's a fact. But there's hope. We eat every day. Reclaim the family table and make it a habit to eat together. In the next week, select one meal when all the people in your household sit down and eat together. Turn off the television and focus on listening. Sharing. Not only will you be fostering better health in your family, but you may find that no one wants to leave the table.
All right, welcome back. Good stuff. Yes, we should eat together. Hi, Dr. McIntosh. How are you?
I'm well, thank you.
Wonderful. Welcome to Your Health and You. And we will be talking about chronic myofascial pain. Now, some people don't know what that is like. What is that? So, Doc, tell us what exactly is that?
Okay. All right, let's just try and break it down. Chronic, that just means that it's something that has been going on for a long time, usually in excess of 6 months. Myofascial, all right, so the word element myo refers to muscle. So it is a condition that is affecting the muscle. And fascia, that is a thin sheath that that covers the muscle. I mean, when you, I don't know, I mean, if you cook chicken or other meat, you see that thin film that covers the meat. That is the fascia. It basically holds the muscles together and allows them to slide and to move properly. All right. So chronic myofascial pain is a chronic pain condition that affects muscle. So a muscle group can be affected from your head to your toe and anywhere in between, and it causes severe pain and disability.
Wow. So you just mentioned two of the symptoms, severe pain, and you say disability. What else do you have with chronic myofascial pain? Well, it says pain.
Right. So before I go on to the symptoms, I should also mention some of the characteristics.
Okay.
So the pain is actually due to the presence of what we call trigger points, the correct term, myofascial trigger points within the muscles. So the trigger point essentially is an area of intensely contracted muscle fibers. Because normally when your muscle work, it contracts and relaxes. But for some reason, some of the fibers in the muscle, they contract and they don't relax. So they remain persistently contracted in a constant state of spasm. And this basically generates pain. And so you get a little, layman refer to it as a knot in the muscle, because that's like, almost like what it is. So you can imagine you have a rope and you tie a knot in it and pull it. Yeah. So that is essentially what the trigger point is. And that basically is what generates that intense pain that affects the muscle. And so it causes pain and also muscle spasm, because the body's response to pain is really trying to protect that part from excessive movement. So that's why your muscles tighten up to keep it still. And so you get muscle spasm. However, the muscle spasms actually cause the muscle itself to tighten, which irritates the trigger point. And so it generates more pain. And in response to the increasing pain, again, the body trying to protect itself sends another signal or more signals to cause more spasm. So it's like a vicious cycle.
Awful pain cycle.
Pain, spasm, until it spirals out of control, And so the patient will be in a constant state of pain, and that pain can be quite intense. It can be disabling, right? That the persons who, they have it so bad that they can't go to work. Persons who and these are extreme cases, but there are persons who, for example, may be confined to their house. They cannot leave home because the slightest activity triggers the pain and they are not able to function. Right? So imagine how serious that can be. So yes. So the cardinal symptoms.
You're talking about symptoms. All right, finish symptoms.
Yeah, so the cardinal symptoms really is pain, muscle spasms, the affected muscles. And the characteristic of this pain is that it is aggravated by anything that causes the muscle to work harder. All right. So, for example, if you have it in your shoulder and you lift up a weight, try to raise it up above your head, then it causes the pain to get worse. All right. Also, you can get pain in other areas remote from where you have the trigger point, which what is referred to as referred pain. So you can have a trigger point in your shoulder, but you're feeling pain in your hand or in your arm. All right. So if you're not aware of that, then you will be focusing on the hand and you're not finding anything wrong there. And so, which is a common thing where patients are told that, nothing not wrong with them, it's in their head. Or they're malingering because doctors will say don't understand about trigger points. And so they don't understand the concept of referred pain. So for example, you have a trigger point in your back and you're having the symptoms down in your leg. Or you have a calf trigger point and you have symptoms in your foot, in your toe. But you do x-rays, you do all kind of tests, and there's nothing wrong in your foot. Right. So those are some of the cardinal features. But there's also spasm, as we mentioned. So persons will tell you that sometimes the area gets swollen. That is really just the muscle tightening up. Right. They also tend to have weakness. The muscle is weak because when the muscle tries to contract to do any form of work, when it gets to a point where it irritates a trigger point, a reflex is triggered to tell the muscle to stop. So it will relax automatically. Wow. So you may have persons, for example, you're in the kitchen, you're washing dishes, And that may seem to be a simple task, but for somebody with trigger points in the arms or in the shoulders, you know, they just holding things in your hand after a while, and you're not able to hold it anymore, and your cup or your nice china will fall from your hand and break
Mm-hmm.
on the ground. You know,
Wow.
right?
Oh, wow.
And fatigue also. So the muscle itself will be fatigued. So and a cardinal example, for example, is a teacher who is writing on the board every day. Normally, she can do that for hours without any problem, but she develops an injury, develops trigger points in the shoulder, and all of a sudden, she starts writing on the board, and within 5 minutes, she has to stop and sit down because she cannot continue any further because of the fatigue and the pain and that extreme fatigue. It's like the arm becomes useless. All right,
Wow.
right. But apart from the main symptoms of pain, spasm, fatigue, weakness, trigger points, as I mentioned before, can occur anywhere in the body, anywhere that you have muscles. And so they can trigger other symptoms unrelated to the musculoskeletal system. So, for example, a lot of persons who are labeled as migraine or tension headaches, their real problem is trigger points in the neck or in the head. You know, it can even mimic heart conditions. So there's a specific point in the chest, for example, when the trigger point is there, it can cause the heart to race and cause chest pain that is similar to what the pain that persons get when they're having a heart attack.
Wow.
Yeah. But the patient rushes to the doctor and they do all the tests for heart problems and everything comes back normal. And they say, oh, it's all in your head. There's nothing wrong with you. All right, so you have to have that awareness. So there can be a whole gamut of trigger points. Symptoms that trigger points can generate depending on where they are located. That's why I refer to them as the great pretenders because they can.
Oh, yes.
They can make any other medical condition. You know.
Wow. So how does it come about? What causes this? How does it start?
Yeah, so the main factor in development of trigger points is overload of a muscle. And this may be acute, meaning that it happens suddenly. For example, if you're in a motor vehicle accident, you got an injury, and very commonly, for example, the whiplash injury, you get this, and that jerks up your head and neck and shoulders and upper back. All right? Or somebody may have a fall. Sometimes you don't even have to fall to the ground. You get a slip, you know, when you slip and slide and you catch yourself up.
Mm-hmm.
Right, so that's sudden jerking movement. Then it causes microscopic tears in your muscles.
Mm-hmm.
And some persons, the body reacts by basically overcompensate, you know, so you develop muscle spasm, which just basically spirals out of control. But it can also happen in a chronic sense because there are many persons who they can't recall any particular injuries, you know, but they may have issues with, for example, bad posture. So, for example, somebody who spends, all day in front of a computer at work, working on whatever it is, their computers, and the area is not necessarily laid out in an ergonomic fashion, right?
Mm-hmm.
So the posture is incorrect, and that puts a chronic strain on some of the muscles, especially the neck and shoulders and upper back. And so they develop, over time, they develop trigger points, right? So those are just some of the issues. But in terms of what actually happens within the muscle, that is still very poorly understood. There are various theories. The main one that is most people accept is where they mention that the muscle goes into like what they call an energy crisis. You know, so something causes the muscle to basically to become overloaded. And so when it contracts, it fails to relax as it's supposed to and remains persistently contracted. And so you get accumulation of calcium and so on within the muscle, which causes it to not to return to its normal state. And because of that constricted state in the muscle, the whole area becomes ischemic. That is, the circulation, the blood flow through it is compromised. So as a result, it does not get enough, because the blood coming through the area is reduced. So it doesn't get enough nutrients. It doesn't get enough oxygen. That's a situation that is called hypoxia, or lack of oxygen is called hypoxia in the tissues. Also, the flow going out is compromised as well. So you don't get the normal washout of your waste products like carbon dioxide and acids and so forth. So those things accumulate. So all of that creates an environment within that area of muscle, which becomes very toxic and irritates the nerves that are in that vicinity, and it develops stimulates become basically sensitized and develops pain. All right.
So this can, I mean, since you call it the great pretender, it can go undiagnosed for a very long time, right?
Yes, unfortunately, because in my practice, I see patients who have been walking around with it, going to a lot of different doctors for years. So they end up coming to me. A lot of them, like I said before, would have been told that they're having mental health issues.
Mercy.
They're mad, or some of them are told that especially in the context of like motor vehicle accidents or industrial, occupational injuries, where a person will accuse them of malingering. That is, they're pretending because they want to gain financial compensation from it.
Right.
So the problem is that it's a relatively new. Well, I say relatively because it's a person would have recognized it for like a couple of decades now. But the knowledge is still very relatively different. It's not something that we learn in medical school. Certainly when I was in medical school, it was not something that was taught.
Okay.
So that's where you have to go back to, where medical students coming out should have that awareness of this chronic. Like I said before in your introduction, it is extremely common. Up to 85% of persons with musculoskeletal pain actually have trigger points and myofascial pain. A lot of persons who are diagnosed with sciatica, for instance, slip disc, majority of them actually have trigger points.
Right.
And so when these patients come to me, I mean, that is the first thing I look for. I look for the trigger points, and more often than we find them and treat them, and they get better.
Wow.
And so
persons, right? Persons who would have, like you mentioned, had a whiplash, or we slide and fall, or we almost fall, but we recover. But you have all of that jerking going on. For me, I have scoliosis, and I tend to have pains in the head. But I just think, well, it's heat-induced migraine or it's something like that.
Right.
It comes and it goes, but there is, and now, I suppose based on what you're saying, I'm starting to wonder about myself.
Yes, so you may very well have trigger points, because I didn't go through the full. I mean, the range of potential causes is very long. But issues with abnormalities of your skeletal system, for instance. So you mentioned scoliosis, because that curvature of the spine, it causes imbalances in terms of your musculature and so on. There are some persons may have what they call leg length discrepancies. So one leg is shorter than the other. Because of that, they're lean, and so it creates another imbalance. But even outside of that, persons who just have a bad posture. So when they're standing, for instance, they're not standing erect. So there's a condition that they refer to as a head forward posture, where the head is out like that, and that causes a lot of strain on the neck and the upper back, and affects the curvature of the spine. So there are a lot of things that can trigger it. But you mentioned that sometimes your symptoms go and come, which does happen in mild to moderate cases, where, because trigger points, there are two phases. Like you have the active trigger points and you have the latent trigger points. Now the active trigger points are the ones that are generating pain, so the patient will be in pain. But they can become latent. Sometimes you take pain medications, or you stop doing certain things because you notice that when you do certain things, the pain is worse, and you stop doing that. That can cause the trigger points to go into a state where they are not so bothersome, and they can actually stop hurting, but they are still there. And if you resume doing the things that trigger them, then they will flare up again, And so that is a typical history.
But Doc, I'm thinking, based on what you're saying, especially when you mentioned ergonomics, and I'm thinking about all these young people with what I call the faux neck.
Yes.
Because I suppose we're going to have a whole generation with this problem. because the poor posture that they use to be on this phone or to be on a computer and so on, I see a problem brewing.
Yes, and not only that, but the constant scrolling on the screen that creates what you call a
And the
condition we
use
call
of the one hand to and the
yes,
two fingers to.
that's create a condition we call repetitive stress injury. All right, so doing the same thing, even though it may be a simple task, but if you're doing repetitively, constantly over time, then they develop spasms and even eventually develop trigger points in the hand, in the forearm, and it can go all the way up the shoulder to the neck.
Wow.
Yeah.
So what if this syndrome is left untreated? What happens?
So it depends. So like I said, some persons compensate, so they stop doing certain things, and
Right.
over time they don't realize it, but for example, their range of motion of their joints become restricted. So they know that, for example, they can't raise their arm freely, so they stop doing it, or they may find a different way to do certain things. And so that becomes their new normal. So that's how they make that adjustment, and so they can actually function until something happens now to stress them further, and then the pain flares up and becomes unbearable, and they have to seek attention. On the other hand, there are those situations where it just continues to spiral out of control. I mean, I mentioned a couple of patients I have who are basically severely disabled as a result. So it can go on for years and years and years, and just continue to get worse and worse.
Oh dear. So how is it treated exactly? How do we treat this?
All right. So the ultimate goal of treatment is to inactivate the trigger points. All right. So it's not just a matter of giving pain medications or giving injection and so on, just something to control. As a matter of fact, it's a condition which does not respond very well to conventional painkillers. So, like if you have a sprained foot, you ice it and you take some pain tablets for a couple of days and it settles down. Trigger points don't respond very well to pain medications. So this typical history is that these patients will come and they're on a myriad. They have tried, by the time they come to the specialist, they have tried all sort of medications and nothing helps. And this is another reason why doctors will tell them that it's in because they it just doesn't make any sense to them. But right, so it's not just a matter of taking pain medications, although you will need to take medications to help in terms of symptom control, but the ultimate aim is to inactivate the trigger points. And so the physical approaches will be the mainstay of treatment. And there are various things you can do. So there are various massage techniques, for instance. For example, a technique that is called ischemic compression, where you apply pressure to the trigger point, in a controlled fashion. And that can actually inactivate or temporarily deactivate the trigger points. And if you do that consistently over time, they will eventually go away. Right. Then you have a similar technique called trigger point release massages, where there are specific massage techniques that you use, stroking, strumming, and so on, which also have a key role to play. And some of those things can be done at home by the patient or by somebody close to the patient who they trust to assist them with that. Stretches, also very important. And this has to be passive stretch, not active stretches. By passive meaning that if you want to stretch the right shoulder, for instance, you're not just going to lift up the arm, but you use something else to stretch it. So somebody else does it, or you use the other arm and do it. You want to keep the affected muscles as relaxed as possible. All right. Before I forget, I should mention that even before you even look at treatments, we have to try to address the underlying cause. All right.
Okay.
What you call aggravating or perpetuating factors, those have to be looked for and identified and treated. If you don't, then whatever treatments you try to institute is a waste of time. You're not going to get anywhere. So you have persons who you're treating and you're just not getting anywhere with them. Usually it means that there is something underlying it that we're not identifying, which needs to be addressed. All right. So it may be your posture, maybe how you stand, how you lift weights. A common situation is a person who, like, you see, a a lady who she have issues with, for example, doing household chores like washing, doing the laundry, and so forth. And you tell them that, well, you need to stop doing that for a while. And they'll say, well, they can't do any better because they live alone or they have a sick mother to take care of. So they have to do all of that in terms of assisting the person with bathing and so on and so on. All of which will put stress on their trigger points. And so they will not get better. The other thing that we have to address is things like stress, which we didn't mention in terms of cause or helping to perpetuate these trigger points. So physical stress, when you work yourself overwork and you're always tired and you're not getting enough sleep, or it can be mental and emotional stress because it also causes when you're under stress, your muscles tighten up, especially with anxiety, and so they will aggravate your trigger points. So those have to be addressed as well. So a lot of times we have to, matter of fact, the management, proper management of this condition is a multidisciplinary approach. So it's not just a one-man show where, for example, myself is a pain specialist. So a lot of these patients may have to refer them for psychological assistance, which is not to say that their problem is not real, but chronic pain on the whole, and especially chronic myofascial pain, where there's a lot of dysfunction, it creates secondary psychological issues in these patients. So some of them develop depression and anxiety and all of that, because you have to understand that this will disrupt their entire life. So they can't work, and especially if they were the main breadwinner of the family, or they contribute, or used to contribute to the family income. Because of this, a lot of families, there's a significant disruption because these persons, other family members sometimes turn against them because now they're not contributing, and as a matter of fact, they are now dependent.
Right.
And persons may even accuse them of being lazy. They're not wanting to help with the chores and all of that.
When they really can't.
Yeah, they can't manage. So in some of these instances, effective treatment really have to involve the entire family or representative who can explain to them what is going on. So back to the treatment though. So other things that we do, injections. So we can do like what they call trigger point injections, where you actually inject directly. If you identify the trigger point and you inject usually a numbing agent, a local anesthetic, directly into it. And that will, take away the pain almost instantaneously. Sometimes it's like magic, So this person will be in pain, have been in pain for years or whatever you do. Put a needle in, inject the trigger points, and the pain disappears. Voila. But that works. Sometimes it works like that, but not always. Sometimes you have to do repeated injections over time. And there are those few instances where it doesn't work at all. So the takeaway message is that there is no one treatment that is effective for everybody. So each patient that comes, you have to work out a treatment plan that is for that individual patient. And their compliance is very important.
Right.
You have a plan and you discuss it, and when they go away, they don't do their part.
I suppose the pain not painful enough. I'm sorry, I'm just thinking out loud. But Doc, tell us now, because I'm curious as I continue to learn more about this. How do you identify these trigger points?
Okay. So everything like as in any other medical condition, it starts with a detailed history. So you have to ask about the pain. So it's a characteristic pattern that they inquire about. So based on where they have the pain, they have an idea where the trigger points might be located, and you will check those areas. So a detailed examination of the patient. So the typical trigger point, when you press on it with light pressure, which in a normal person would not be painful, but that person sometimes they can feel a little lump under the skin if it's not too deep, but sometimes they don't. But whatever it is, sometimes if you press on that spot, that tender spot, that tenderness is so exquisite that they want to jump off the bed. They want to jump, or they will cry out, ouch. It's an involuntary response. So that they actually have a name for it, the jump sign. All right. Sometimes you can see when if you press it sharply, you can see a little twitch of the underlying muscle. You can palpate the taut band of muscle along So you will have a band of muscle within the larger muscle group, where those fibers are always contracted. So it feels like a rope or strings running along the muscle, which is not normal. All right. And so once you find those taut bands, if you palpate along it, then you'll come to the spot where it is extremely tender. That is the trigger point. Okay.
Oh,
And
okay.
when you press on that trigger point, no, not only it hurts, but the patient will identify that pain as the same pain that they have been having all along. And
Okay.
sometimes it creates pain. If they're having referred pain, they can say, "Oh, I'm feeling it in my." If you're pressing on the shoulder, they're feeling it in the side of the head, or
Wow.
so on. Right. So, and when you put the needle in, you always get that muscle twitch. That's it called LTR. Basically, is a muscle contraction that you get. All right.
Okay.
When you put a needle into the trigger point. Yeah.
You mentioned in your opening some of the, I suppose, misdiagnoses, for want of a better term, people experience this pain and it can be mistaken for other
Mhm.
things. Can you just mention those again? I remember you saying heart attack.
Yeah.
Um,
Yeah. So it depends on where the trigger points are located. So if you look at different regions, so for example, in the head and neck, any condition in the head and neck you can think of.
mm-hmm.
So for us, if you take a dental pain, for instance, so there are reports of persons who are having repeated dental surgeries, wisdom teeth extractions, and all of that. When the problem is not in the teeth, so they are having trigger points in their neck, which is referring pain to the jaw. All right. Same thing with what you call it with the ear. They are ringing in the ears, and all our pain in the ear can be coming from the neck as well. Matter of fact, even more serious, a person may having dizziness,
Mm-hmm.
and they think maybe they're having a stroke or something. You feel faint and dizzy. Again, trigger points in the back of the neck can do that, and there's a term for that: cervicogenic dizziness. Okay. And so you have to be aware of those issues. So even the eye, you can be having blurred vision, feeling like sun grains in the eyes, the eyes drooping. Again, trigger points for the muscles at the front of the neck can do that. All right. So we mentioned the one about the heart. There's also, for example, trigger points in the middle of the chest, especially at the front, which can mimic peptic ulcer symptoms and so
Mm-hmm.
on. So persons will be on gas medicine, all kind of things, and just the condition is not settling down. The doctor can understand why
Right.
it's happening. You know,
That is not that at all.
right. And even I think I mentioned a person with sciatica. So
Mm-hmm.
persons are diagnosed with sciatica, and that one is very common because the problem with the sciatica, is that our slip disc person will come saying that Dr. Salim that they have slip disc. Is that you do an MRI on persons in say in the elderly age, say a 60-year-old, and you see an abnormality of the disc, like a disc prolapse. It doesn't necessarily mean that that is what is causing their pain. Because if you take 100 persons in that age group off the street and do MRIs on them, the majority of them will have that same finding.
Right.
But the majority of them are having no problems.
Mm-hmm.
And so that is a common cause of what we refer to as failed back surgery syndrome. So of course
Mm.
they come in and they are diagnosed with this prolapse, and the doctor says, "Oh, you need to have surgery because the pain is so bad." They go to surgery, do a nice, beautiful, successful surgery, but afterwards the pain is still there
I never
because
got.
the disc was not the cause. So
Right.
so so we have to be careful when we see those things and question whether is it really the disc. So in terms of so person with trigger points in the lower back, or like paraspinal muscles, and also especially, probably I should say, in the hip muscles, just in the vicinity of, if you wear pants where the back pocket would be, those set of muscles, especially one that is called the gluteus medius. All right. When those have trigger points, um, the sciatic nerve passes very close to that area. So these trigger points and the resulting spasms in those muscles, it irritates the sciatic nerve and create that shooting pain down the leg that's characteristic of sciatica. And so a person will say, oh, you're having a slip disc and you need urgent surgery.
Mm-hmm.
But one other thing that separates that kind of pain or that cause from pains due to or weakness, because some person may actually present with weakness in the leg.
Yes.
Right, but weakness in the leg from a disc compressing the nerve roots in the spine will cause those the area in the leg, those muscles affected, to atrophy. That is, they get smaller because of the compression of the nerve. The opposite will happen with persons who have trigger points. In fact,
Mm.
either the muscle is normal size or they may actually be larger
Okay.
than the normal size because of the spasm that they have. All right.
So that is
So
a telltale sign.
yeah. So I mean, there we could spend all night talking about
I realize.
the unusual symptoms that trigger points can present with.
Yes.
For the ladies, for instance, pelvic pain is a big problem. So normally when a lady presents with pelvic pain, traditionally we would be looking at things like pelvic inflammatory disease or endometriosis or those things. What
Yes.
we are realizing now is that a lot of them are having myofascial pain in the pelvis. And the same thing for us men who may be having recurrent episodes of this pain and being treated for years for prostatitis and other conditions. They actually have pelvic myofascial pain. So we have to be aware of these potential diagnosis. So it doesn't mean that everybody who comes with pain, they're going to label them as having trigger points and myofascial pain. So
That's right.
especially if the pain is potentially, you have to rule out other conditions. So even though you
Mm-hmm.
may have a strong suspicion that this is trigger points, you also have to
Be
check
thorough.
and make sure that you rule out any serious alternatives. So for example, the patient with the chest pain, you have to make sure that they're really not having a heart attack. And so you do the
That's
test.
right.
But when the test come back negative, you're not going to tell the patient that they're mad. You're going to say, okay, your heart is normal. And so more than likely what you're looking at here is trigger points.
Yes.
All right.
Yes.
Yeah.
So can this be cured or it just goes into dormancy?
No, it
Is there
can be cured.
can be
It can
cured?
be cured. I mean, the majority of patients will actually have the trigger. Once they go through the treatment program, then the trigger points are inactivated and they return to normal function. Doesn't mean that they can't come back. Because the same
Right.
way they did work in the first time, they can also come back, especially if the person has not made the modifications on it, because you always teach them. And this is why patient education is probably one of the most important aspect of managing these patients. They have to know what to do and what not to do.
You're
So
right.
we
You're
always
right.
stress to them, the lifestyle modification that they need to embark on in terms of regular exercise and managing their posture, managing stress. So even I did mention vitamin mineral deficiencies, but these are also important for especially
Mm-hmm.
vitamin D and so on. So they may need to go on supplements and stuff like that. But it is possible for them to be cured. But unfortunately, there are some persons who will not get better, and sometimes it's because of non-compliance,
Mm-hmm.
because they have to go home now and they have to do daily, sometimes twice daily stretches and massages, heat treatment and so forth. So it's not just when they come to the doctor, which may be once a week or once every other week, as the case may be, or go to a trained physical therapist who may work with them maybe twice a week. It's a daily thing that they can do, what they need to do for themselves. And sometimes that is the hardest aspect, to get persons to comply, because it takes effort on their part.
Right.
And a lot of our population, they have this mindset that they go to the doctor is supposed to sort them out.
Right.
Right. Right. And there are others who have underlying issues which are going on, which we just cannot identify. Sometimes that happens. I mean,
Yes.
you check everything, but that there must be something that you are missing.
Right.
And the other fact also is that if it goes on for too long, some of these patients may turn up years after the initial injury or the start of their pain. And unfortunately, there are times when the nervous system develops because of the constant barrage of pain signals going into the nervous system. It changes it. So it develops a response which basically hardwires that pain. That pain becomes ingrained, and it's very difficult to unravel.
Oh, wow.
So those patients can actually go into a state of intractable pain as a result.
Oh, dear.
But thankfully those are not very, very common. But it's something that we bear in mind. So, yeah.
So you would have answered my question, because I was about to ask you about vitamin deficiency, but you did mention just now in your response. But I want you to, I suppose it's a myth. You did mention it earlier, and I had it as one of my questions: is myofascial pain psychological or linked to mental illness? So I need you to declare it.
Right. All right. So there's a link, but not the link in which many persons will assume. So it is not a psychological condition; it's a physical condition. So it's a disorder of a skeletal muscle, and it can occur. It can occur in any muscle from head to toe. So we see patients with trigger points, with severe headache. I mean, the head is on fire, and it can have anywhere down to the toe, right? But the psychological impact, though, is tremendous. I think I mentioned that it is tremendous because
yes, you did.
The being constantly in pain, and especially they can't function. They're having issues at home because of the disruption there, because of their inability to participate in the functions of the home. You have problems within spouses because one spouse is affected and cannot function in that manner. All of these things can happen, and so persons can develop depression. They develop other psychological issues, anxiety. They're worrying, for example, will they ever get better? Are they going to have to spend the rest of your life living like this? Also, may even wonder if they can believe in terms that it's a simple thing. They must think that, it must be something more serious like cancer or something like that, and so they are worrying and fretting over that. Is it something that is going to take their life? But it's not by itself a life-threatening condition. It's just that it can cause a significant amount of pain and suffering.
Right. So there's pain, there's suffering, there is psychological impact from being debilitated, or it's affecting your livelihood, and so wow. So you would have heard it this evening about chronic myofascial pain. If you have never heard it before, like Doc is saying, it's fairly new. I suppose there's research going on, but you would have heard it on Your Health and You. So I'm going to ask you now to stay with us. Remember to post your questions or comments in the chat. Dr. McIntosh will be will be here to answer some of your questions, and also we will have our naturopathic remedies section. So Dr. Joan Lamley is here to tell us about how to deal with myofascial pain the natural way. Right after the break, we will come back.
Grateful people take better care of themselves. Researchers found that study participants who kept a weekly gratitude journal exercised 1.5 hours more than the group who recorded daily hassles. In another study with adults having congenital and adult-onset neuromuscular disorders, participants who jotted down their blessings nightly reported more hours of sleep each night, falling asleep faster and feeling more refreshed upon awakening. That's a fact. But there's hope. Each of us has a list of health habits that could use improvement. This week, enhance your lifestyle by spending a few quiet moments each day counting your blessings. After all, positive behaviors are driven by a positive attitude.
right. Welcome back, Sister Joan.
Evening, everyone. I'm right here, my dearest.
Hi, Sister Joan. How you doing? All right. So tell us, how do we manage myofascial pain naturally?
All right. Dr. McIntosh. Good evening, Dr. McIntosh. Good to see you. And
Yeah. Good evening.
yeah, you had mentioned so much that we need to be taking note of, and I'm going to mention some of the things that you look at. But there's something that I want us to go back to, and it's a statement from the book Counsel and Diet and Food. No, Ministry of Healing. Let's go to Ministry of Healing. It said that in the case of sickness, the cause should be ascertained. Unhealthful conditions should be changed. Wrong habits are to be corrected. Then nature is to be assisted in our effort to expel impurities, and to re-establish right conditions in the body. All right. So if we take disease from that aspect, whatever is going on in the body, that in the case of sickness, there is a cause. There is a cause. Nothing, pain is a symptom that something has gone wrong inside. And it's a cry to you to find out, what am I not doing right? All right. And there's one part that I want to jump on quickly that he had mentioned. And this was the part when he mentioned calcium. All right. Mineral deficiency, I think, is one of the main cause, all right, of this chronic pain that's taking place in the body. So when he mentioned that calcium thing, calcium is needed for the contraction of the muscles, right? But there's something else that's needed now to help it. And if that one is missing, then you're going to find yourself contracting and not relaxing. The other part is the magnesium, all right? So he mentioned that the calcium have to be there, and it is true. So we are taking in some of our diet, Jennifer, is just not good. We don't eat with a sense of purpose, and you are literally what you eat. So for me, that would have been the first place I'm going. What are you putting in your system? All right? Is your food such that the body can build itself from it? Many of us will like things like dairy food, dairy milk, and dairy milk causes your bone to be porous. It's not the best kind of milk to give you strong bones and health and all of that. Magnesium is, to a large extent, very deficient in our diet. Where are you going to get them? In your greens. And most of us, we don't eat much greens, honestly. You find a little bit of it on the side of your plate, all right? And we don't take the supplement. So we are in, and the magnesium is needed for the relaxation of the muscles. So here it is, calcium causes you to contract, but you need your magnesium to relax. And of course, he mentioned another one that we have to look at, vitamin D. No vitamin D, no calcium, no magnesium action, because it's needed. And God in his mercies, because he knows that we need it so desperately, he has blessed us in the best way that the body can get vitamin D, the sunlight. But in general, we are afraid of sun. We are afraid of the sunlight. All right. And as long as the body is not getting enough vitamin D, even the wonderful calcium and the wonderful magnesium is going to be like kind of useless in your system. So my first suggestion, please, what we have, audience, we call them, Jennifer, our participants, and please enjoy the beautiful, wonderful sunlight that God has given us. It is one of the best remedies for disease that we can get. All right, and we need to start using it. And another thing that we do, look at some of the food. Some food, they are inflammatory by nature. The body cannot use them well, and when they go inside of your system, the body is more stressed than help. And of course, he mentioned stress. So stress causes cortisol response in your body. But if you constantly stress your body, too much cortisol is going to be there, and it's going to lead to inflammation. All right. What are some of the inflammatory food? Processed food by nature, the tin foods that we eat, the dairy food that we consume, anything that is sugary. All right, they are inflammatory. All right, and no, you want to go to the anti-inflammatory foods. So you're going to look at your fruits and your vegetables and your whole food. We need to move away from the denatured food. So you have something like white rice, white bread, white flour, these white things that don't occur naturally in nature. All right, so we take them apart. Another thing is that the human body was made to move. And many of us, we don't move. We don't exercise. Nature moves. Everything in nature moves so that it can live. Some of us, we have very sedentary lifestyle. And because of that, the muscles are not getting the activity that they need to ensure that they can work. So we're not eating well. We are not exercising. We are mineral deficient. And so you look now, the cause should be ascertained. And we can literally look at ourselves and know that our lifestyles are not in keeping with the laws that exhibit for our overall health. Another thing is that we are afraid of looking on the skinnier side of life. So we like a little fluff. And the more fluff we have, is the more likely that the joints are going to come under pressure. All right. So we need to try to keep as much as possible within our ideal weight. All right. Because every extra pound that we put on, we can get away with a few, but the more we are going to put on is the more likely that we will get sick. But I like another thing is that God in his mercy now that bless us with many things that can help us to soothe the symptom, which should have been the pain, because pain is a symptom. All right. Pineapple is excellent for helping with the pain management. Beautiful. Man has taken out the bromelain from the pineapple, which you get from the inner core, that hard part on the inside, and they have given you in supplement as bromelain, so you can buy that and you take. But in his mercies, God put it as a complete food. Isolation is not the best thing that you should do. All right. So as much as possible, you go to your whole food. But for some persons in their chronic state, you might need a little help. All right. One of the best things that I'd use where practical application is concerned is hot and cold treatment. You remember we talk about calcium and magnesium for contraction and relaxation so that healing can come. It's the same with hot and cold treatment. The hot is going to expand your blood vessels and the cold is going to contract it. So you see, nature in itself provides that way of how we are supposed to be using the minerals. So you use the hot as warm as you can take it so that the blood vessels can expand. Then you use the cold to close them back, and then you continue with that process. We do the hot for about 3 minutes and the cold for about 30 seconds. And I've seen persons here with joint that could not move. Right. I think the doctor had told her it's a symptom pain, but she was crying. I guess that's what Dr. McIntosh was talking about. She was crying because she was having the pain, but they could not readily identify anything that was going on. And I sat right here in my office and just do the hot and cold treatment with her. When I was finished, I used some olive oil with the cayenne in it and massage that. And by the time she was able to put her hand over her head to praise God. Now, the other part now is the maintenance that he mentioned. It has to be maintained. So I did the first treatment just to show her, and her daughter was with her, that you have to consistently do that while making the lifestyle changes. So I'll just go over them quickly. You have to be exercising. You don't have to go through any great rigors of exercise. Walking, and when you walk, you just try to swing the hand. If the hand is not moving well, one is not moving, try to use the other one to help it. All right. Try to put in range of motion, meaning that if you find the hand not going over, don't get comfortable. Well, my hand can't reach back there, and you leave it alone. It is for you to try a little manipulation so that it can move. Then make sure that your diet is one that is filled with whole food. Move away from the processed food. It does not give nutrients, so your body can be nutritionally deficient. You might be rich and famous, have all the money, can buy food, but you can be nutritionally deficient, malnourished with all your money because of the things that you're eating. And if the body is not well fed, it's going to cry out. It is going to cry out, and you're going to see the symptoms. You're going to take something to quickly get rid of the symptoms, right? But the underlying cause is there, and over years, it's going to know develop into something that become more chronic. They become so immobile. So you find persons are bending forward, leaning one side, and all of this because they are accommodating the pain. When once pain is there, get to it. Another thing that we need to mention that I don't think person drink enough water. I don't think we are drinking enough water. We take water for granted. We take water that's something you must just take up and drink it when you see it. You are literally walking water body. Yeah, you need water. Water is needed for sustenance, for the flexibility of the body. You need to be taking in water, and I don't think we are doing a very good job of that. So we have to be very conscious and make the effort to take in more water. So these are just some of of course, I use herbal treatment, but I think the lifestyle changes are more relevant for us now. And if we can start putting in some of them, then you'll find that you'll get a better result in a shorter time. All right. So
Okay. Yes, ma'am. Thank you. So, Doc, I am online, and I see where Sister Wright has asked a question. She said, I have been suffering from pains in my left knee for months that has extended to my hip. I experience tiredness in the entire leg, even when I'm not moving. What could be happening?
Mhm. Right. So it will be difficult to give a definitive answer, in isolation,
Right.
because apart from the symptoms, we also have to examine the person. But she says she has pain in the knee. Does she has pain in the calf as well? Is there any cramps or tingling or numbness? You know, so I mean, it could be related to trigger points, but we cannot say definitively. Because what we would do, so all right, so a lot of persons diagnosed with arthritis in the knee, for instance, they actually have trigger points in the lower thigh and the upper calf muscles, and that is fairly common. So it is possible that she may be having trigger points, but we cannot say unless we do a proper
Yeah, for
examination.
examination.
Yeah,
Right.
what she can do is if she can examine herself, so she feels along the calf, and identify if there are like tender spots, these little spots. Sometimes you feel a lumpiness in the muscle, and when it's pressed on some of these lumps, it's extremely tender. Then those would be may very well be trigger points. All right, yeah, but it is possible. All right, but she would need a comprehensive assessment, and we have to rule out. For example, she didn't mention if there was any swelling. So if there's swelling in the knee, for instance, then it would be more likely to be some kind of arthritis. Especially if
Okay.
it's warm as well, and sometimes effusion or fluid in the joint, which are things that we would have checked for if we were to examine. But if she has not seen a doctor yet, she need to see get a proper assessment.
Okay. So Luke says, if a person's head is big, can it put a strain on the neck?
Uh, all right, so usually the Lord makes us perfectly. If you have a big head,
If you have a big head, you get a big neck.
the other things that are important to support that head will be in place.
Yes.
So So it's not so much the size of the head, but it's rather the posture.
Yes.
Because in the proper posture, when you stand, the weight of the head the head is directly aligned with the trunk and with the legs, and so that there is no rotation forward or backward. I mentioned before the head forward posture, where because the head is slightly in front of your body. And in order, especially when you're walking, to see where you're going, you have to tilt the head up like that in order to maintain a level gaze. And so that put a lot of stress on the neck muscles in particular. Because even for a person with a normal size head, the head is a fairly heavy object, you know. And so when the alignment is not correct, a lot of strain goes onto your neck muscles, which over time cause the development of strains and trigger points and so on. Yeah.
All right. So Janice is saying I have pain on my side for, I think she wants to say for a year. And Dorothy is saying, what causes a cramp in my feet? So I suppose the response for those would be similar to what you've said before, that they
Mhm.
really would need to see someone to get a proper examination to
Right,
determine these things, right?
right, because they will make sufficient information because the potential causes also vary according to age, or you know body weights and you know stuff like that, your lifestyle in terms of how activities, how active you are and so forth. You know.
Okay. So,
Mhm.
Sister Lamley, Elaine is saying, what is the best type of calcium to take? She's
Um,
also saying, before you answer, what can virgin olive oil be take? Can virgin olive oil be taken if I don't have magnesium?
well, virgin olive oil is not a good substitute for magnesium. So if you don't have magnesium, get some magnesium. All right, about 400 mg would have been suitable. Um, and well, the instruction would have been there, or you talk to your doctor about it. But calcium, better than milk. Sesame seed is a very good source of calcium. You also have it in your vegetables, especially like cabbage. Your green vegetables, they are packed with calcium. All right, and almonds are a good source of calcium also. All right, so if you can balance your diet, we make sure that you are getting some seeds and some nuts. All right,
Okay.
then you that can help you a great deal. And if you're not taking things that can block your calcium from absorbing, which is another thing again. All right, so because there are some medications that can do that, there are some foods. Sugar especially is not really the best thing for us because it causes the body not to work as it should. All right, and it even affects your nervous system. So if you can get these in and cut down on the processed food, as I had mentioned, then the body can adequately take care of itself. And the thing with calcium is that it is so prevalent in so many things that it is not mainly the cause of deficiency. You'll get it. The other parts now that's needed to work with it, that's where the problem normally is. So the magnesium or the vitamin D or zinc for that matter, most times that's where the deficiencies are. If those are there, then most food has calcium anyway.
Okay. So Maxine is saying, I have a painful trigger thumb. Sometimes it's hard to open a simple bottle of water. Will the pain go away?
You know, I
All right,
saw.
so trigger thumb is a different condition. So the trigger thumb is actually an inflammation and overgrowth of a tendon that controls the movement of the thumb. Because you know your muscle is attached to the bones that control the joint by the tendon, which is the end of the muscle, and inserts into the bone in thumb. So when the muscle contracts, it actually pulls the tendon to cause the thumb to move. So there's actually a little sheath. How do you describe it now? So there's a compartment that this tendon has to pass through. They have to go underneath. It's like they're going under a bridge, so to speak. So when the tendon gets inflamed and over time it gets thickened, and sometimes it even form like a little knot on it, and so it doesn't pass freely through that bridge. So that is what happens. So when you bend the thumb, it pulls through, and then when it's straightened out, it is restricted. And sometimes you have to use the other hand to free it, and you hear that little pop. All right. So that is an orthopedic problem. You go to your orthopedic, or let your doctor refer you to an orthopedic specialist who can deal. Sometimes they can deal with it in the office. In a severe case, they may actually have to perform a little surgery to release that trigger. It can affect the thumb or it can affect the other fingers. Trigger finger, trigger thumb. Yeah.
All right. So Sister Wright is asking when she can visit your dog, because she's saying she would have done several x-rays and ultrasounds and blood tests, and there's still no answer to her pain. So she wants to know when she can come and see you.
Uh, well, you can take on that with the number, with the phone number, and
Oh boy.
Well,
one of
well,
the one of the things that I find out, Mark, is this. we have to sometimes look back at, go back to the statement. The first statement I make, in the case of sickness, the cause should be ascertained. I find out when my nurse started working with me, the same thing that was mentioned, which it was her thumb, and it would just collapse in the midst of us just being there. And I said to her, listen, we teach health. You cannot come out with me with your body collapsing like that, sister. So let's work on it. And this was before COVID, so she has been with me, and it's no longer there because I treated it through deficiency, looking at her body. She was a night nurse, so she works in the night and in the day sleep, so that the body was not being exposed and what they eat in the night and all of that. So after working with her, she's fine. It has never occurred again since then. All right. And another lady I had, she had carpal tunnel. That's what was diagnosed. And she was terrified of this surgery, I'm going to get her cut and all of that. When she came to see me, I said, all right, I told her about, in the case of sickness, look back at your body, looking at her lifestyle. Her body was collapsing because her lifestyle was not what it should be. So after going through and making some correction, and I gave her the B vitamins, the complete Bs in a liquid form. And I didn't even remember that, and that's she says about 5 years ago, and she has never had the problem again. So I like to look at deficiencies. Take care. Some of the bodies, doctor, they need cleansing. The bodies are not clean. We pack a lot of impurities in them, and it's like your house. If you don't clean it out after a time, if you pack a lot, it's going to, well, like, let me use the drain. If you keep putting things in there and you pack all of these things and you don't take time out to clean out that drain, there's going to come a day it's just not going to work. And that is what sometimes happening in our body. Sometimes it says the body must be cured of impurities, and give it that opportunity, because the body doesn't want to collapse. The body doesn't want you to have pain. But if it doesn't scream out through pain, you will do nothing about it. And you'll just stay until one day you just heal over. So pain is
Yes,
your friend to tell you that, listen, there are
something
things
is
that you
wrong.
need to, yes, and you need to think about it and do something.
Wonderful. Boy, I know we could sit here and talk for more hours, but unfortunately, we are out of time. So, the last question I see here is: should we get a doctor's advice before taking calcium and magnesium? So, like 2 seconds. Yes,
And
no.
yes, don't
Yes.
do things that you don't know what's going on with you. There
Right,
can be other things going on. Yes, see your doctor.
Dr. Mac. Your last 2 words.
Um, well, just to reiterate that chronic myofascial pain is extremely common. A lot of people have
Yes.
it. So we need to spread the word so that persons,
Yes.
if you're having unexplained pain that is unremitting, not responding to other things, you need to get it checked out. It may very well be. And the treatment, a lot of it is self-treatment. So patient education is a big focus in terms of
All
what you can
right.
do for yourself at home.
Amen. And we must understand that patient care means me and my care provider. So we have to follow the plan. And we
Right.
always have a part to play. That if we don't play that part, more than likely, we're not going to get the result that we want. I see persons here asking for numbers. Sister Lamley, can you share a number quickly? And then Dr. Mack, can you share a number? And then we are out of here.
Yeah.
All right. So it's 876-779-6759.
I hope they got that.
Yes, 779-6759.
All right. So I am at the Villa Medical Center.
Villa Medical Center.
Right. And it is 625-9395.
All right.
625-9395.
All right.
Or
So I hope you have gotten that Villa Medical Center. If you don't get the number, you can look it up. And I'm sure a lot of us know Sister Jones' number, but I'm hoping that you would have gotten it. So thank you, Dr. Mac. Thank you, Dr. Joan, for joining us tonight. I know this was quite interesting, and I see persons still commenting, so I know they would have gotten the information. 87 persons I see online, and I'm asking you to remember to share this week's video plus other videos that we would have had. So thank you, our viewers, for joining this evening, and thank you again to our special guest. Thank you to Sister Mishka, our tech support, for being with us this evening. Now, next week, Thursday at 7:15 p.m., we will be focusing on prostate cancer. 3 John 2 says, Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. God bless you and good night.